What causes high and low wheezing in COPD? Imagine trying to breathe through a narrow pipe or a wide tunnel. That's kind of what wheezing sounds like in chronic obstructive pulmonary disease. Wheezing is that whistling noise you hear when someone exhales or sometimes inhales. It happens because the airways are narrowed or blocked, making airflow turbulent. The pitch of the wheezing depends on where the blockage is and how tight it is. High-pitched wheezing usually comes from smaller, more peripheral airways. These tiny tubes are more sensitive to inflammation, mucus buildup, or muscle tightening. When they narrow, air has to squeeze through a smaller space, which speeds up the airflow and creates that high whistling sound. This type of wheezing often signals more active or severe airway narrowing and can be more noticeable during flare-ups. On the other hand, low-pitched wheezing comes from larger central airways. These airways are wider, so when they get blocked or swollen, the airflow slows down and produces a deeper, more muffled sound. You might hear this wheezing during both inhalation and exhalation if the larger airways are obstructed by mucus plugs or swelling. The causes of airway narrowing in COPD include ongoing inflammation that thickens the airway walls, making it harder for air to pass. Excess mucus production can partially block the airways, and muscle tightening around the airways, called bronchoconstriction, can also cause wheezing. Structural damage from long-term disease, like loss of elastic recoil or airway collapse, adds to the problem. Over time, airway remodeling happens, which means fibrosis or thickening of the airway walls, making them even narrower. During COPD flare-ups, inflammation and mucus increase, making wheezing more noticeable. Recognizing whether the wheezing is high or low helps doctors figure out which part of the lungs is most affected. This information guides treatment choices, like using bronchodilators to open the airways or anti-inflammatory medicines to reduce swelling. Monitoring wheezing sounds can also help predict when a flare-up might happen, so adjustments in therapy can be made early. Understanding the source and pitch of wheezing gives a clearer picture of how COPD is affecting the lungs and helps in managing the condition better.